So this device here is our cavitation device, and cavitation works by using ultrasonic waves, so a vibrational wave, and this is why your client can sometimes hear the high-pitched noise as you are doing the treatment. So these sound waves are what's travelling through the dermis layer around 20 millimeters deep, and it's causing a vibration between the fat cells. So there's microbubbling, which is then causing the fat cell to turn from a fat cell to fatty acid due to the vibration. Your body is then going to metabolize these fat cells and start to get rid of them. This is our radiofrequency device. So the radiofrequency works by warming up the tissue layer and the dermis layer of the body. So it's used in medical settings first to help heal scar tissue. So as this warmth goes down through the dermis layer, it's stimulating your fibroblasts, your collagen and elastin fibers, resulting in tightening and toning effect. As you can see with this client here, and this was just 40 minutes between these photos. So, doing a body sculpting treatment. So after we've had the consultation and we've assessed the client and we've worked out what it is that is bringing them to us, we're then going to allow them to get onto the bed. We're going to then start to apply the ultrasound gel. The ultrasound gel is really important during the treatment because not only does it protect the skin during the radiofrequency, but it also helps the technology to go deeper into the dermis layer to have the optimal results. And we also need a nice glide throughout the treatment. So starting with the cavitation, so this is the one that causes the ring in the ears because it uses sound waves. We're going to start by going around the belly button in a clockwise position. It's really important we always go clockwise because we do not want to cause constipation to our clients. So we're just going to start by doing nice circles and just allowing the client to get used to the noise. We're then going to swap from doing circular motions to straight glide box square like I'm showing on the screen. To sculpt the hips, we're going to be starting to do V's. So V's are when you go out to the waist, to the belly button, and then out to the waist, and then drawing down towards the groin. So we're creating a nice V shape. That's going to really help to sculpt the hips and the waist. We get a lot of ladies coming in prior to their weddings when they've got a nice mermaid tail dress because it's the waist that they want to sculpt. And again, you can see here I'm doing the nice V, so towards the belly button, down to the groin, and then going back into doing circles. So now the figure of 8. The figure of 8 is really important for anyone coming in with lower belly issues, where they're wanting to really tighten that lower mummy pouch, we call it. So we're going to do nice number 8, and that's just going to really break down that. Some women have that slight overhang, especially if they've had a cesarean. So this is where you would do the number 8, making sure to pull down any underwear and the towel to make sure you can get really underneath that scar line if they do have cesarean, or just get nice and low. So it is really important to keep topping up the ultrasound gel, conductive gel, barrier gel. It's named different things between different wholesalers, but we just want to make sure we always have plenty down on the client's skin. So I like to have it in a bowl next to me, and I just use a wooden spatula that I just replace with every client. And we just want to make sure there's plenty down, especially for moving on to the radiofrequency, because the radiofrequency is the device that warms up. So this ultrasound gel or barrier gel on the skin is protecting the skin from warming up, and it's allowing the dermis to warm up instead. This is just going to help reduce any risks of burnings, although that is really rare to happen because you just need to always be keeping the device moving. So with the radiofrequency, we're going to be moving the device similar as we started with the cavitation in circle motions around the belly button. We can move this device in a slower motion because we want the dermis layer to really warm up to trigger that body's wound response, repair mode. It's called the same thing. Basically, we're tricking the body into thinking that there's a wound, so it's going to heal itself, and that's what's stimulating the collagen and elastin fibers, resulting in the nice tightening and toning effect. Similar as when you go and have a microneedling, but instead we're not having those little puncture wounds, we're just warming the skin up. So again, we're now doing the box shape that we did with the cavitation. So radiofrequency and cavitation you use in very similar motions, except from with the radiofrequency you are slowing it down slightly. So now we're going to go out to the waistline and we're going to do those V's just like we did with the cavitation device. So So typically you do cavitation for 20 minutes and radiofrequency for 20 minutes. But if you visually assess your client and they need more tightening than they do for fat reduction, then spend more time with the radiofrequency. A lot of women feel that they are fat and they go to the gym and they just can't shift it, when it's actually lax skin. It's loose, sagging skin that just needs to be tightened. So this is where these treatments come in really handy, because we can pick exactly where we want to treat and we can decide if we need to tighten the skin or if we need to help reduce some of the stubborn fat cells in the area. So again, this is the figure 8 that we did during the cavitation. This one is going to be more beneficial for the clients that are coming in post-pregnancy or post-weight loss, because we're tightening the skin. So doing these V's are going to really help to tighten that lower stomach area. Some women call it the mummy pouch. And radiofrequency has also got the benefits of helping to reduce scar tissue and the pigment within it. So if someone does have any scars from stitches, cesarean stitches, this is going to help reduce that redness. However, we do need to wait 6 months post the operation to be able to use this device. And the great part about these devices is because they are handheld, it means that you can really target those areas that the clients are coming in about. So you could spend 10 minutes on a specific area and you're just going to work your way around the body for the amount of time. Then we're moving on to the lymphatic drainage at the end of the treatment. So with this, we're going to be using our knuckles, and we're basically working everything from the waist, like we did with those V's, to the middle of the tummy, and then working down the belly button towards the groin. And this is just helping to shift all that stubborn fatty acid that we've broken down, and just helping to remove any water retention, ready for those after pictures. So how do we work the sides again? So when you do have a client coming in like this client here that really wanted to work underneath the bra strap, you can get them to roll onto one side and just work across the waistline, really opening up that treatment area. And we're just going to be putting more pressure on the way back towards the belly button, and then we're going to help drain that down to the belly button using that lymphatic drainage that I showed you in the previous clip. And now I'm going to film from the other direction so you can see, just working straight across those areas.